This parasite doesn't need a host to be created. It's built outside the human body and waits. Most parasites depend on animals to survive. This one depends on human behavior, unclean water, improper food handling, invisible mistakes. That's how Entamoeba histolytica spreads, and why millions of people never realize they're infected. This parasite begins its life as a cyst. A cyst is not active. It doesn't move, it doesn't feed, but it's nearly indestructible. The cyst forms when the parasite exits an infected human through waste. Once in the environment, it can survive for weeks in water, soil, or on food. This is how the parasite is created. Not in a lab, not in an animal, but in contaminated environments humans return to every day. Here's what makes it dangerous. The cyst can survive. Heat, dryness, chlorinated water, and stomach acid, that means drinking water that looks clean, can still deliver a live parasite. Once swallowed, the cyst reaches the small intestine. There, the shell dissolves. The parasite activates. One cyst becomes multiple active amoebas, called trophozoites. This is the moment the infection truly begins. At first, the amoebas stay in the intestines. Some people feel nothing. No pain. No warning. Others develop diarrhea, cramping, and fatigue. But the parasite doesn't need symptoms to survive. It only needs time. In certain cases, the amoeba changes behavior. Instead of staying in the gut, it invades the intestinal wall. This causes inflammation, ulcers, and bleeding. And now the infection becomes Amoebiasis, a serious parasitic disease. Once the intestinal barrier is breached, the parasite can enter the bloodstream. The most common destination? The liver. This is where the damage escalates. Inside the liver, the parasite destroys healthy tissue and forms abscesses, enclosed pockets of infection. These abscesses can grow silently. Symptoms may include fever, weight loss, upper abdominal pain. Extreme fatigue without treatment, liver failure can occur. Here's why this parasite is so dangerous. Symptoms can appear weeks or months after exposure. By then, patients don't remember the water, the food. The source and diagnosis is often delayed. In rare cases, the parasite spreads further, to the lungs, or even the brain. These cases are uncommon, but when they happen, they are often fatal without rapid treatment. You might think this parasite is a thing of the past. It's not. Entamoeba histolytica still infects millions worldwide every year, including travelers and people in developed countries. All it takes is unsafe water, improper food, washing, poor sanitation. The good news? This infection is preventable. Clean drinking water, proper, hand washing, fully washed or cooked food, early medical treatment. These steps stop the parasite before it ever activates. This parasite isn't aggressive. It's patient, and it only succeeds when humans give it access. If you want real infection stories explained clearly, subscribe to the channel. Because the most dangerous threats are the ones you never feel coming.